Macheloni, nikhoba takanenza kha ezempilo zwamutakalo na Dr. Prue. Namusi rikho wamba ngamafungo abuthongwa ngamanda abulwanze ba vaccination and immunization. Kanti-ke angihambi ngedwa, nginazo izihambeli zami la kwezempilo. Ngina Dr. Maphotho ongazichaza kabanzi ukuthi uye bani.
Ngiyalemuka Dr. Prue, Mamuli Lanulaharo. Nna ke le bitso ke Ramukoni Makhosazana ke tswa ke belego go Bagambeck, which is Limpopo. Ka dira primary ya ka tloga ka dira high school ka fetsa matric ko Mokopane, and then ka tloga ka dira medical studies ko University of Free State. Ka boa ka bereka ka tla ka nna ka tswelela di studies tsa ka di college ko Medunsa, which is University of Limpopo. By then when I knew ke sefa ko Makhosazana ka dira specialty sa ka in biology.
Oh, so you are in virologist.
Ake virologist.
So who are virologist? Who tsia sebaka se kanang doctor?
Hoja virologist is a specialty sejia dia mengware e for gore e tlhano ya le gore wena already being but period ka moka age ya 5 years, and then wa ngwala exam what research, and then ba go first certificate sa go specialist.
So uthomile ka undergraduate MPCHB wa tsena for 6 years. Wa boela sekolong hapo wa specialize wa ira 4 years. Ba dula batho ba go sekolong. Ke a tshepa le wena mo o le hae o nya go ba virologist ka tsheko wa tseba gore re thoma kae re ye kae go ba o felletse o be virologist. Sina Dr. Dlamini. Dr. Dlamini ungamchazela ukuthi umbukelo sekhaya ukuthi uwe bani?
Ngiyabonga Dr. Prue. Mina igama lami Dr. Makhosazana Dlamini. Ngokuphuma eMpumalanga province. Ngiyangithanda ukuthi ngikhule all over eMpumalanga. Ngikhule eCarolina, did my primary school there. I-high school yami ngayifunda eZinikeleni, one of the high schools eCarolina. Then ngaphinda ngafunda Lindas ka eLona eNkomazi eMahushe agricultural school. Then nangiceda matric ngicedele eHighfield Comprehensive eLkwatini. Ngithanda ukuthi vele I'm a proud Mpumalanga girl. Then ngase ngiyahamba ngifunda i-medical studies wami eMedunsa. Qualifying in 2004, so far I've been practicing as a general practitioner, a secunda. Based the secunda practice, I'm a vendor, and recently I qualified when I travel medicine, of which is subject let's do kulmaga banding.
So ungachazela umbukele ekhaya ukuthi traveling medicine sesikhuluma ngodokotela osebenza yani?
I-travel medicine ngudokotela lobuke kakhulu into tempilo letibukane nebavakashi. Sibuka ukuthi umuntu nakayovakasha kahlahle ngokomthetho sikhuthatha ukuthi umuntu ate ku doctor to check ukuthi uyakhona na kuyovakasha, kukhona ama vaccines la kufanele wathole, sibe siyamluleka nalapho ukuthi ayakhona ukuthi ngitiphi into yafana bukane nato leti to ba senkingeni leto beka impilo yakhe engcupheni, bese siya advisor futhi netilo efana hambe nato, siphinde advisor futhi ukuthi umuntu nakabuya abuye kudokotela sibone ukuthi ngitiphi into labuye nato. Sometimes abantu babuya nokugula, abantu bayalimala, baphecelele sibuka nje into ehlangane nokuvakasha. Netinto ehlangane netempilo.
Siyafunda kwezempilo zwamutakalo, siyaqala ukuthola udokotela ukuthiwa traveling medicine doctor. Kanti namhlanje sesiyazi ukuthi bakhona kanti futhi kufanele sibavakashele nini. Sisi Nomasomi, ungachazela umbukele ekhaya ukuthi ubani?
Ngiyabonga doctor. Mina nguNomasomi Limako isibongo. Ngizalelwe eGauteng ekuruleni. So ngikhulele la ekuruleni, ngafunda khona. Ngiqale ngafunda eZibeleni special school for people with disabilities. Ngaqhubeka ngaya ePhiladelphia ePretoria. Then ngase ngenza i-computer, ngaphinda ngenza i-community based rehabilitation, and manje ngiyi-activist.
Siqhubeke ngodaba lwethu namhlanje. Siyabonga kakhulu sisi Nomasomi, ngibonge nakini bodokotela. Dokotela asingene endabeni namhlanje. Sikhuluma nge vaccination and ngaphambi kokuya ngene lapho kukhona nina as virologist kube khona kuthiwa yini microbiologist ngakusichazela ukuthi lifapana byang
Rafapana and Maraka, Mehaimichua and Logo Tlaka. Virologist, Dr. Wa, who studied the viruses, diseases because of viruses, and microbiology. Dr. Lohor will study the microbes, TB, and so forth. So Rafapana got the type or the microbes still level under the microscope.
No relebo vaccination, immunization. King pila.
And then lot of body confused, body shumisha interchange. Vaccination is process ya create vaccine. Immunization is process ya create vaccine, and the process is generally after vaccination. So immunization is an overall description. You are getting the vaccine and in your body when you get the vaccine. So the vaccination is purely or vaccinated or that vaccine into your body, whether through injection or body drops into the mouth.
Who banning to vaccinate? Who would talk about
vaccine is and I underestimate in most cases, but it will talk about Ona lady dikukwana hloko jelo hore harna treatment for jona, and the best way already prevent. So vaccine it prevent those diseases jelo hore harna the antibiotics, or even if harna the antibiotics, so we create it's severe infection. And lo na protect batho ba le hore aba kgone go vaccinate because of the medical disease jelo hore tlabana jona. So in effect a vaccine, we jail fella for wena, we jail a liver to ba haufilu wena le setšhaba so that we protect her from the other diseases jelo bona because abana chofela ba khona go vaccinate o khona go vaccinate go ba khona
protect especially how tsena COVID batho na ba bolela ka di herd immunity a go re tlhalosetse ka tsheko ka language ya rena re tlhalosetse batho go gae gore ke eng herd immunity.
So herd immunity or handshake explain again nka back to har leveling immunity na go tshwana le defense force.
Yeah.
So Department of Defense Force in a army in a air force which is go in a navy. And then it have a control in between. So our immune system works like that. Or hello horo hona le something like gamajin air force we've got different types of immunity. So herd immunity era hore heke create vaccine. Or they create ka bunchi most chavi. Maybe really 90% ba le hore they create re kgona ho protect 10% ela. Higher because of medical issues, or vaccine. So, it's a public health issue. So, it's like a herd, it's like you are protecting your community by being vaccinated, a lot of you. So, what we call a vaccine coverage, fast. The outbreaks. So, pockets study diseases. So if a revaccinator, at least 90%, unality viruses they are fapana or revaccinator over guy or create herd immunity. Usually polio, you need only 85% their population or okonogra herd immunity. Utana libo strep pneumo, elo recosa pneumonia, you need 95% because then respiratory to gauge. So yeah, depend on and then level okay, hey, this one, but 95% or 75% of the population. That's why we want to president at least if we for COVID here vaccinate a certain number of people, because it's a statistic analysis that you do or vaccinate 40 million of the population, we are around 60. Then we cover our lowering medical issues or even religious issues, but that is the statistical analysis. every virus will protect.
Awa ba boele go haela tlhaloganya byanong he re bolela ka herd immunity go baneng re tlhoka gore re vaccinate batho ka bontši ba bona ra ithuta ka jeko doc a re tsene byanong mo tabeng ya gore a shiwo vaccine ke gopola ka yona covid ba re go na le chip ka mogare ba bang ba nya gore what is it inside ya vaccine ya covid ke nyaka byanong re tse ka di type because di fapana ke re di type tsa di vaccine kopela o re tse mo o re botse gore di teng ka nnete di chip tse or bjang.
So really mekgwa e le type tse dintsi tsa meento and it dia ka technology gore re di dirile jwang in the lab. So what we call live attenuated. So re tšea virus ra into the lab ra dissect ra tšea di karolo tše le gore di dia gore motho a heads and into the body a be le the disease. So we take out the infectivity side virus and then we clean that A1 shading and then we propagate it until such time that even if reka introduce it will not cause disease. So that get life attenuated. Then we have what we call whole killed. So whole killed, excuse me, came Raja virus again, and then Ribolaya chemically. Arranges anything, Ribolaya as a whole. We take it because high sali life. Raja, Rai clean a leona, Rai locally into a vaccine, Rai inject, or econo then who activate the immune system or grad antibody gela. And then what we call subunit killed. So subunit regia a part because a virus come on in what we call glycoproteins, in what we call envelope. So just section L. And then we take it out of the virus, we put it and we look at it or we introduce the antibody. If yes, we've tested in various things. If yes, then we take that part and and then give vaccine. So most of the hepatitis B vaccine, they are made from the subunit technology. You've got pertussis that is made out of whole. You've got the ones, the live attenuated, measles, for mumps, for rubella, and other influenzas. So you get that those are what we call traditional technology. Now with the new ones, you've got a newer technology now, virus vector, which will the vaccine COVID are made of. We've got virus vector, you've got here mRNA, which is the most popular one. So the mRNA is basically I get a virus in the genome RNA or DNA. So basically what we are doing, we share the DNA. So every person learn the mRNAs. mRNAs is the messenger that are telling your body what to produce, red eyes or blue eyes or green eyes. So even the virus has got that to tell a virus or now can you uncha a glycoprotein or take out this and this and that. So we've learned there is that mRNA. So we're taking out that mRNA. It's not infectious. We take it out, we clean it, and optimize, and then I look at like so what it does that mRNA, it goes because now it produces S gene. So it will produce a S gene here, corona. But that S gene alone, it will never cause you a disease because you need the whole virus for it cause a disease. So that S gene, it will then produce the S antibodies, then you become protected to a certain level, and then that's it. Then from there, the immune system can just do the job. So those are the newer technologies that we have. Hona le vaccine immediately tse ba di kreyang and le batswadi rena le gore tsamayang le se bana skaleng ngwana a ye skaleng and then ba mo fe di injections tse di vaccine kopela gore tse tsona from ngwana a fetso belega gore ke efeng the vaccine e ba mo fang yona and o tle le tsona nje ke list ya polo ke list ya polo mara ga ngwana a fetsa go belega o kreya two vaccine o kreya page and drops.
Okay.
o kry-a polio ke di-drops sorry I get confused ke polio ke di-drop and then ke BCG ke on your territory again.
Okay.
So BCG ke ya TB and then
TB hape bjanong no bolela re thata ka di-virus kanti ke eng e causang TB
TB ke mycobacterium, so ke bacteria.
ke bacteria mo
So yeah,
yeah
a more EPI, what we call expanded program of immunization,
Yes.
which is the program a Department of Health developing for the vaccines jabana. So okay, more the vaccines jabana in the public sector because they can over more go private banally additional ones according to affordability. So with public health or you go clinic, but of OPV, which is oral polio vaccine. So the oral polio virus vaccine, ke preventing polio disease.
Okay.
Right? So refer through the drops. So if we were the drops, one of the drops immediately after and then okra BCG ya TB, and it's the only dose BCG one of the for the rest of and then got 6 weeks. One okra another OPV, get drop, and then we look a rotavirus, which get drop but rotavirus preventing the diarrhea, severe, because of dehydration, I admit to a alwale and so forth. And then ukrea hexavalent. Hexavalent ke gore ba bone hore ngwana ha ka tla 6 weeks o kry-a meento e 10 the injection all over. So what we did is then ba combine 5 vaccine in one.
Okay.
So that child will protect you with different disease mara in one vaccine.
Okay.
So krabo pertussis, agrea tetanus, agrea IPV, which is called inactivated polio. Remember the subunit again.
Yes.
So IPV ke part yela subunit mara ke inactivated polio. So era hore ngwana ka 6 weeks o kry 2 doses ja polio mara ke different
differently. Okay.
So by the time ngwana fetcha 6 weeks o se jana le 3 doses ja polio.
Oh.
So mo South Africa
a go tshware gona mo ka polio e gora gore polio e botlhokwa thata polio e infecta bana ba bantši of bjang because re na le Nomasomi o bene poliomyelitis ngokucabanga kwakho ukuthi mhlawumbe wayithola kanjani
mina ngokucabanga kwami mangibuza kahle ukuthi ngaqala kuphi ukugula bekwenze njani, and then I was told ukuthi ngagula ngimncane benginabo 11 months to 1 year mangqala ukugula, and it was an epidemic by then.
Okay.
It was an outbreak of polio,
alright.
and bengise Transkei ka bubabam, that's where I got it, and then yeah ngayithola ngaleyo ndlela.
So but uthini mama masibheka ikhadi laphana ube sekutholile ama 3 doses njengoba dokotela achaza la
No, I don't think so.
you don't think so
I don't think so.
okay
So remember, Dr. Prue, the EPI program, it started in 1994. So prior to that, neither here nor there.
Okay. Okay.
Like we said in the section. So the last case by South Africa was in 1989. So prior to 1989, there were a lot of cases.
okay a re continue re tla boela gape go Nomasomi a re continue mo ka di vaccine ntse re di tlhalosa
So regularly vaccine PCV. PCV is a pneumococcal vaccine. So pneumococcal vaccine it prevent batho gore ba ska kry-a pneumonia or it streptococcus pneumonia. And then Hemophilus influenza, Lona ecosa the influenza, ecosa extra pulmonary problems, renally cellular pertussis, the whooping cough, and so forth. So the hepatitis B. So last 6 weeks is the first dose here, hepatitis B or what we carry. So right now discussion go on re up or what banana velo hamba green cape because at level most of hepatitis more pregnant.
Oh, okay.
immediately has a flu hepatitis B, then automatically chronic hepatitis B infection. And it's so severe later on, more. So there is that discussion. And then go 6 weeks, go 14 weeks, more or less the same 1 year, go 6 weeks.
Okay.
But go 10 weeks, harna rotavirus. So rotavirus if we go 14 weeks. Then remover go 6 months. So 6 months is the first time we're not looking measles vaccine. So measles prevented measles infection, deafness, pneumonia, and so forth. And remover go 12 months. 12 months is the second dose. Yeah, measles. And then go 9 months, we get 9 months PCV again, third dose of PCV. And ka 18 months, another PCV and hexaelagabulation for 6 weeks. And in most cases, but when you are level, 18 months, additional years, 6 years, 12 years. No one about DTaP. So DTaP is tetanus and diphtheria. So they look prevent for vascular whooping cough, the tetanus, especially because now but the Nakos Columba, they get laceration or crying, or they can combine soil, mahual or nakawa, such a later on. And additionally, later on, especially by Banaba Banyana, but HPV at the age of 9 years. So basically, that is the program here public.
So the teenagers, 12 years, by a HPV vaccine.
So what
Banyana fail.
Banana fell on budget for HPV. So by Shimani have I told you, but it looked like a banana Shimani by Banyana, 9 years or grade 4, grade 5.
Oh, okay. I wrote sorry, Honamo. Says Nomasomi, I guess to Begelan. So in Flambe, but easy pimpa or Bonagalangas uti so infected with polio.
Out being huta.
Okay.
I was having diarrhea and being overheat. And the thing is numb.
Okay.
Not by then be sing hamba. But after Polio, I couldn't walk. The sing as I couldn't even no casa. I was like moving like a snake. That's what my sister used to say. Nomasomi was moving like a snake. So that was the main issue.
Okay. Ungabe uthole ukuthi njengoba ube ne poliomyelitis ukukhula kwakho kuku-affecte njani nje ekukhuleni kwakho?
Mina ngibe affected ngenye indlela because in most cases angikhulelanga endlini due to being ne-polio. I had to go to special school and I had to be in and out from the hospital. My operation, which right now I find it they were so unnecessary because nothing was being rectified by those operations. It was like unnecessary pain for me to be done. Yes.
Doc, I should ask Nomasomi. They tried to operate. Pila isn't mortally infected kabo poliomyelitis. Is there a way who baka mo treata ka yona kapa jwang?
So poliomyelitis harna treatment ya yona, harna di antivirals for. So that's why lo hore mahamantshi re tla gore re tsweletse vaccine go pele gore batho ba kgone vaccine because ke one disease lo gore harna the antiviral. So once uba infected polio, we just waiting for the immune system how and if it's a J-Carolo to extend the control polio, you end up with disability or end up with encephalitis, inflammation so you can end up with that.
So pila polio affected the nerves.
Yeah, it affected the nerves. However, it goes through the mouth. Yeah, eating. So any usually infected polio or and then hits and it's right into malinga how ba bang ba tshwara ke diarrhea, ba bang pele ha bana diarrhea at all. O no ba le fever, and then the next thing o palla go hospital.
Mo go hae he ngwana ana le fever ana le diarrhea go ra gore go serious it's better or o mo senga keng gore a tlhatlhowe pele. Dr. Dlamini njengoba dokotela sachazile ukuthi sikuthola la eklini naba abantu bayahamba bayatravela to different ngifuna kakhulu laba abatravela beze la kithi ukuthi yiphi vaccine efanele bayithole uma be la eSouth Africa ngoba kusho ukuthi makufanele umuntu osuka eCanada ezela athole lo vaccine kusho ukuthi fanele thina kube nathi sesivaccinatile ngalo vaccine le imaphi lawo vaccine lawo.
Udokotela sachazile ngalawa la ku program extended program of immunization. Ku travel medicine lokunye lesibukako ukuthi bantu kakhulu sibuke ukuthi ama vaccine ebantwana kuphela. No aphelela nje sebantwaneni kani ku travel medicine kukhona iconcept ye beyond childhood vaccination. Noma ungakahambi eSouth Africa kukhona ama vaccine ekufanele wathole. South Africa is a developing country. There are certain parts of the country la ngana good sanitation. So noma ngabe ungayi kuyaphi uyadinga ukuthola a booster shot ye hepatitis A if awukasuyithole just ukuvikela because awungayitholi hepatitis A infection le serious na ikubambile abone nama complications la serious. So for umuntu lobuya outside of the country lo the South Africa ngathi nje babukeli kukhona ama sources longaya kuwo lo to wa checka ku internet like for example CDC. But in South Africa, coming back to travel medicine, kukhona South African Society of Travel Medicine, which is a source longathola kiyo actually ma vaccine efana wathola now South Africa. So ngatuka lawa doctor la khulume ngawo kukhona ama vaccines lesithi ma mandatory vaccines la funakala unafana ku South Africa. Lamanye kufana ube nawo not because ikhona South Africa but because fana uvikele abantu ba South Africa. And then lamanye fana ube na fana wathole because fana uvikele now ku South Africa. So ma mandatory vaccines currently according to ECDC and SASTEM, the South African Society of Travel Medicine, if ubuya ku country le yellow fever vaccine or undlule let's say use Canada but decide ukudlula via West Africa inzawo le yellow fever vaccine if utohlala kuleyo country airport for more than 12 hours it is expected would now figure South Africa to produce a vaccine certificate ye yellow fever even if South Africa yellow fever aksi vaccine aksi igugula lokhona because uvikela nebantu base South Africa sivikela ukuthi kungabi khona outbreak in South Africa.
Okay.
And then the current COVID, it's a regulation, it's a recommendation. I think at this moment, at the current moment, it's not necessarily mandatory, but it's recommended that you should produce a vaccine certificate to vaccinate you in COVID, or at least have a negative COVID test of any producer within 72 hours, if I'm not mistaken. And then coming to my vaccines, if it's South Africa, if there are parts of South Africa where there's poor sanitation, is expected to 20 vaccinate hepatitis B, hepatitis A because of poor sanitation. It's also recommended that travelers that will hepatitis B vaccine because in South Africa it's endemic.
Okay.
Also, lenye vaccine they recommended during the flu season to totally influenza vaccine, tole measles, mumps, and rubella because those infections are still very quite common in the country. And then, there's quite a lot.
There's a lot. Ngifuna singene la ku yellow fever. Yini yellow fever?
Yellow fever, it's actually one of the hemorrhagic diseases. It's caused by a virus. It's caused by a flavivirus. I personally feel maybe I'm listening to Togotela. I'll expect virologists to explain it further. But it's a virus letholakala ngokuthi umuntu infected by alunywe by an infected mosquito. The mosquito le transmitter yellow fever, it's one of the Anopheles mosquito. It's usually but it's a day biting mosquito.
Okay.
So now for risk yellow fever actually you shall avoid mosquitoes that would bite you during the day. It is common, it's endemic in West African in parts of West Africa and also in the subtropical parts of Southern America. Symptoms of yellow fever, they say majority of the patients who have yellow fever, they are asymptomatic. And then a few can develop fever, can develop very non-specific symptoms that can be easily confused for flu, like develop fever, body pains, muscle pain, they can have nausea and vomiting, they can have diarrhea, very non-specific symptoms, and then usually it resolves within within a short period. Usually if a patient departs by yellow fever, they say the incubation period is 3 to 6 days. So if somebody travel in a country where there's yellow fever, we expect that person to be symptomatic at least after 3 to 6 days. Then after that short period of illness, some patients by Polio will be right. But abanye, within few hours or few days, they develop severe forms of the disease. Severe form of the disease where they develop hemorrhagic disorders, where they bleed, where they develop they develop shock because of blood loss, and they can end up having multi-organ failure and can lead to death. And the unfortunate part, which there is no a particular treatment. There's no
yellow
specific
fever except with vaccinating.
Vaccination is key. So for yellow fever, like this issue to move to South Africa or in any other country, according to there is international health regulations, regulations that were formed by the World Health Assembly. I'm going to further deep guy, but I'm going to highlight the importance of coordination during COVID. You know, like COVID is just an infection leveling us it down. But all of a sudden, there is a detailed, coordinated response. So, yellow fever, the concept of COVID it's new, but the whole thing of how to handle coordinated response to vaccinations have been there, like yellow fever. Like vaccination certificates is not a new thing. They've been there. It is so according to the IRH, the regulations that were revised in 2005 and adopted in 2007. Then it was established which countries must coordinate in terms of controlling these infections, and yellow fever vaccination was one of those that were revised. Which if mundu ubuya from those countries, no mangabe uya in any part of the world, it's not every country that is participating. Unfortunately, I think it's about 196, 97 countries that are part of the IRA that have signed the regulations. As we're speaking about the yellow fever, doc, lokunye ngifuna ukuhighlight ukuthi ngoba sibukane nenzaba ye-COVID nema vaccination certificate. Inzaba ye-vaccination certificate, it's been there for a while. When it comes to yellow fever, one of the travel requirements, if you are going to an area that's endemic with yellow fever, you must produce a certificate you go to vaccinate you. When it comes to the black population, it's been an experience of most doctors. You know, 2 days before travel. And you will find out yellow fever. If you're going to go to the travel medicine provider or your travel clinic, in a period of less than 10 days, then the immunization you will not acquire the expected immunity. And now figure in the area of travel, in the destination area, you might be expected to quarantine, wait until you acquire immunity. As much as Mundulo Buyagu, an area that's yellow fever endemic, if you don't come with a proof of certificate of vaccination, you'll be expected to be quarantined for a period of 6 days. Because it's clear of our symptoms. So coming to issue with quarantine certificates, it's not a new concept. It's been there for a while. So for Mundu Gutsi Abe immunized with yellow fever and have a valid yellow fever certificate, you must get it at least 10 days before travel. And you must produce it at good destination yako. There are cases where somebody can be given a waiver. Even the waiver you're vaccinated must still be given by a qualified travel medicine provider. Njengoba Dr. Ashidektaleni ukuthi njengoba vaccinators la ukuthi sisite labangebakhona vaccinate. Bantu laba contraindicated from vaccination, mundu lomunye mundu une allergy to the yellow fever. vaccine. So it doesn't mean with an allergy to yellow fever vaccine, then you can't go to Brazil. If you have a valid reason why you can't be vaccinated, you don't have a waiver. But in those countries that are so strict, you have to produce a proof, a certificate, or you must produce a waiver. Kukhona different indications. I think mundulo allergic to the vaccine, no less than 6 months is also contraindicated from being vaccinated. Okay. And then there's absolute relative contraindications. Like if you're breastfeeding, it's recommended that you should not. Okay. If you're pregnant, it's recommended that you should not. If you've got immunodeficiency, like HIV with low CD4 count, if you're on immunosuppressive therapy, like you're on steroids, you're on chemotherapy, you've got cancer, and it's a must that you must go to West Africa. Then you'll produce the waiver. But hence pre-travel consult. Is it really necessary? Is this travel really necessary? Immune system and maybe the trip is really not necessary. So parts of the aspects the travel medicine practice which is advice. Is it really necessary to travel? Can we protect you? If we can't protect you, where are you going? Are people immunized? Are you going to be safe in terms of law? The whole thing is about controlling the spread of disease and protecting those who can't necessarily immunize. So yellow fever vaccine. In the past, they used to say, Mundu, we are vaccinated, a booster shot after 10 years. But since the regulations were revised, then it was stated, it's immunity for life. Oh. You are vaccinated. You must just keep the certificate with you. If you don't have the certificate, if you lose it, it's best that you go to your provider, because we need the batch number as a proof which you did get vaccinated.
And yellow fever, ngathi awuyitholi noma kuphi. Kukhona ama vaccine free njengoba dokotela shilo, kukhona lawa afanele uwabhadale. Yellow fever, is it one of those that
yes,
ungasicazela nje namanye mhlawumbe ama vaccine lawo ukuthi mawutravela vele lawo uyazi ukuthi fanele ukhokhe imali
wabhadala. Yes, yellow fever is one of the mandatory vaccines, and you can only get them from a qualified travel medicine provider who's a holder yellow fever license. And then you have to pay for it. It's not part of the EPI. Okay. And then also another mandatory vaccine, it's the Menacra, the meningococcal vaccine, the one that's recommended kakulu for people who are going to the Hajj pilgrimage. And in Saudi, you have to get Menacra. It's a mandatory vaccine. Okay. Lenye, that used to be mandatory. I think it's the cholera vaccine, but it's no longer mandatory. But it's recommended that you get it. And then the second ama vaccines that are important, that are not part of the EPI that you must get. Especially South Africa, hepatitis A. Hepatitis B, measles, mumps and rubella, chickenpox vaccine, because those infections are quite common.
Okay.
And also influenza. Logo highlights I think COVID influenza. Influenza is still there. People must still get the flu shot whether they are traveling during the flu seasons. Logo highlights if flu short, there's different types according to the hemisphere. So I would say we vaccinated South Africa for the influenza, but now we are traveling to another country in the northern hemisphere. It's a different strain. You might not necessarily be protected, so you need to find that out before you travel. La Manyema vaccine, la recommended, or even the pertussis, diphtheria and tetanus. EPI was established in 1989. So, vaccinated before, you can't just take it for granted. You must be vaccinated. Then, if interesting vaccine, if we are outside of the country, if you get Kruger, I know the international people love to go for adventure. It's recommended that you get rabies vaccine. They like to play with the animals and they get rabies, which is a debilitating infection, and you rather be protected than to.
Asingene kumarabi because abantu abaningi bazi ukuthi imarabi it's when ulunywe yinja kuphela. Nangidokotela uyasho ukuthi noma udlala nezilwane uma ngabe umuntu mhlambe esenawo amarabi uzobona ngani?
Rabies, it's a very serious infection. It causes severe neurological complications. I think a dog can come in.
So rabies, like Dr. has just said, it's a very severe disease and life-threatening. So you get it from a bite via domestic animals or cats, and all that. And you also get it from wild animals.
Okay.
So we always say for fairly unprovoked bite, it's likely to be rabies. So this animal is, you wake up your dog Njaya how is just fuzzy, it's just, horrendous, it's high sharp. And then you say, no, Mara, it's scratch. That child's in a week or 14 days, I think the incubation is about 14 to 28 or even beyond that. This child start to salivate. This child's acting somehow. Neurologically, the child starts, having issues of encephalitis. And once that, when I agree that encephalitis, you can forget. There is no cure. There is no antiviral.
Sure.
And most of the time, it's 100% mortality. So when I agree, through that sequences, harna ela asymptomatic or they all end up in clinical disease and subsequently there is a vaccine that we can give. So only a period where after was no you can have that vaccination series to complete it and prevent the clinical disease.
Mbukelo uyazwela lapha ekhaya uma ngabe ulunyiwe yinja noma uyikade ekhaya ungathathi lula lokho ngoba nango bodokotela bayachaza ukuthi amarabi nawo isifo esibaluleke kakhulu esingagcina sikubulele. Dokotela kutla Dr. Mo ubulela ka hepatitis A, hepatitis B, kanti di hepatitis C ke eng pila ke tse kae?
Hepatitis so hepatitis A inflammation at the liver, right? So really different causes inflammation at the liver. So the hepatitis A, B, C, D, E, and the last one was found is G. The virus contributed to inflammation at the liver and subsequently cause the liver. So hepatitis A recur like Dr. Ornavlet recur through oral fecal. So if there's poor sanitation, it's sort of self-limiting.
Poor sanitation.
Poor sanitation means or the pit toilets hadia cleaniwa. Who involved in her lady storage they are running high bana ba tlhape matsogo ba boa toilet or even in dikolong ra tseba gore di toilet tsa go sekolong da hadi maemo a kgahlisha. So area tso ke tsona tse le hore re ka thola hepatitis A.
Okay.
And most of the outbreak o tlo di kry-a ko dikolong ko di crèche mo le gore there's an area le gore la tlhakanela dijo or le tlhakanela mo le tlhapelang hona or so forth.
So the symptoms of hepatitis A tloba?
So the symptoms o tlo ba le fever, ngwana ba le jaundice or matlho a hae a ba yellow, or a ba le diarrhea, and then but she was better. Some of the kids are self-limiting. Yona high fit and it's not chronic. However, how we career as an adult, it can problem. Because we career as an adult, it can end up a liver failure. It is also no failure as or tomorrow require transplant again. Or it can end up a heavy multi-organ failure and you can even die from hepatitis A as an adult.
Okay. And then hepatitis B, Yona?
Hepatitis B recur through injection, maybe telohorum hadia cliniwa, recur through blood systems, even sexual transmission, hepatitis B, and then jajulong ba mawe fitisha ko ngwaneng unborn child. So maternal fetal transmission so in South Africa it looks like recur between the ages of 1 and 5. Not more in from mother to child, but more into the ages of 1 to 5. We are not yet sure the cause for hepatitis B because less is that bana have a credit injection much of. The form transmission so most of the cases, but like hello or gamokai only motwaji or only an adult or musajana hepatitis and in the share the utensils mama lepola jaga di bana ba khona kra transmission mara is a transmission or in if about to be further or kiona and the cause high cases kama South Africa. So hepatitis B and hepatitis B in a vaccine. Hepatitis A in a vaccine.
Yeah, okay.
However, hepatitis C in a vaccine.
Oh, okay.
So hepatitis C and B, the share transmission route. So the transmit a similar way. So sexually you can get through injection or even blood transfusion infected hepatitis. So it's worse because it ends up a liver failure. And not self-limiting when it comes to hepatitis C. So later on 10 years, 15 years down the line, however, in a antivirus delimitant to replication. So it extends or it prolongs your life. But it's a chronic medication. So you're not have no vaccine for you. And D is a silent one. Usually, for virology, you can't get B without C. You can't get D without C. So now hepatitis B, you are likely to have hepatitis D. Because hepatitis D, it's popular like hepatitis B. So it can affect you without hepatitis D. So you hemotuanal hepatitis B, usually say I'm tested for D. But D has actually clinical importance here on end up liver failure or what it is hepatitis D. Then we move to hepatitis E, which is highly important, or even if you get it only pregnant, you end up in abortions. You've got problems with the mother. You end up jaundice, liver failure, and they can even the mother hepatitis E in pregnancy. And Leona E important to go evaluation by immunodeficiency. So if you get it, only transplant their kidney, heart, or any other transplant, or hepatitis E, you will end up with a liver problem. You will end up with a liver cancer.
Benongaka, ho na le batho ba bang ba hore hai I'm HIV positive. Like le hona we nka COVID. O kry motho a re nna ke na le diabetes, ha ka tshwana o kry vaccine or bana ba re hai o HIV positive so belegile le HIV positive a ka misa skaleng. Re reng ke ba ba fing batho ba kare vele o a ga tshwana o vaccine or
so HIV by itself is not really a contraindication for
okay.
However, renality absolute and relative contraindication here Dr. Ababule. So if you are heavily suppressed, which are 8 stage, and then you need to consult the doctor how to discuss the benefits and the risk of getting the vaccine itself. And then if Dr. Hafila you will benefit more of vaccine than actually having the other disease, then you discuss it and you decide whether to get it or not. But by yourself, as much, because HIV, go to your doctor, examine the whole thing, immune system, and then la level hore ana he o file vaccine ya mohuto because so in most cases they are not contraindicated for vaccine, but the level of immunity that is there. Because but for HIV right now, they for a very long time. Yes. So if they for a very long time, they are going to come across the vaccine for themselves. So whenever medication for a long time and not heavily immunosuppressed.
Yes.
Those vaccines.
Okay. Mutona le cancer, chemo, can they vaccinate?
Lehona mo chemo the contraindication just certain like about who receive what we call life attenuated.
Okay.
So it's contraindicated for them to receive the life attenuated vaccines. But body subunit, body whole blood, whole kill, body acellular. So those then will be the ones that they will discuss with the doctor. Even discussion is a no be life attenuated.
Okay,
So they will
okay.
need hepatitis. They will discuss the pros and cons. And pros and cons are more to do with a reaction or an anaphylactic. It's not to do with are they going to revert back to virulence once they're in the body, of which Haley discussed they can get it even prior to that, even the life attenuated, prior to chemo, they can still get them to say, okay, we are going to start chemo in March, and we think that you can, you are able to carry the life attenuated, so that when you are heavily suppressed, you have antibodies that can carry you. So it all depends on who discuss as only oncologist and the time before chemotherapy and the time alimo chemotherapy. It over so you discuss that, and then and then once your immune system pick up, then you go for those vaccines.
Those vaccines. Refer one dose, second dose. Like now they are angry because the COVID barely one dose. Since about dose they just one dose, and then saying so credit dose this are failing.
So again technology that we use. Okay. So we explain here life attenuated, killed, and so forth. So life attenuated, they are much more robust. They produce antibodies at a higher rate and much quicker.
Yeah.
So those ones you are likely not for Oscar receiver the boosters. But Haley killed what's up unit is because the immunogenicity does not kick and much quicker and much more robust. So you will need the booster scalar for a long time. But again, also level the immune system. If you are heavily suppressed, you'll always need a booster later on in life because your the antibody so whenever you boost the and our elderly. So our elderly also need the boosters because the immune system, the memory of the immune system fades away. So then you need to at least remind the immune system by putting 1 or 2 doses. So the adequate antibodies.
So the vaccines that create because from the age of 12 years banyana tshwantse create HPV, but the vaccine.
Herpes zoster.
Okay.
So the zoster vaccine it holang the shingles. So sanchuba create vaccine ewe. And then Basanchua create influenza vaccine. Actually, they are priority more influenza vaccine. Sanchua create every month. Sanchua create well pneumococcal vaccine. So it's important for that because their lung, quality or quality of breathing high or right. So they need to get the pneumococcal vaccine. And the last one, DTaP as well. They need to also get a DTaP later on.
Dokotela, ngaphambi kokubasivale nakho ngifuna ukuhamba angikaka vaccinate yini into efanele ngiyenze especially asiqale nje ngokuthi hepatitis B ngiallergic nakuyo ngivumelekile ukuthi ngihambe kufanele kwenzakaleni
Hepatitis B, because akusi a mandatory vaccine.
Okay.
Njengoba sisho ukuthi sibuka ukuthi is it important ukuthi uhambe.
Okay.
Vile dokotela athi this hepatitis viruses dingagcina then they liver failure. So kufanele choose ukuthi you want to take the risk of not having your liver functioning or must you really go on that trip for the sake of a bucket list. Kubalulekile shortly I've seen go practice people who have gone for travel when they got my complications last serious. It was before I did travel medicine. Lokunye motivated, and then also now as a GP you realize I would say maybe this person was not fit to travel. So we take it very light. So now to hamba firstly go and consult and kukhona ama principles lesiwasebenzisa ku travel medicine ukuthi oqala kubalekile ukuthi umuntu lofuna ukuvakasha realize kubaleka ukuthola advice yokutravel. You must first realize the need to seek advice, and then this you seek the advice, and then after that you decide is it really necessary, must you go or not, and you must get it from a qualified person lotokwati kukwaluleka phecelezi. So if uyahamba, advise ukuthi at least be 6 to 8 weeks before you travel, go consult, do your research. Don't book, you know, khona abantu ababhukhayo, umuntu abhukha eMozambique because ukuthi pregnant. You are contraindicated ukuthi uthathe amaphilisi lofanele wathathe ukuthi uye khona, or book it should be Brazil and you are pregnant. It literally means you're taking a risk on the pregnancy. You cannot decide whether you want to go or not. So 6 to 8 weeks before you travel, go consult, see if you are fit to travel. Sitobona lapho ukuthi vaccine, if you are allergic njengabo hepatitis A vaccine, if you are allergic to the vaccine, you can take an immunoglobulin, which gives you a bit of immunity for about, I think, up to 2 months. So you can still travel. It's not the end of the world. So when a mandatory vaccinations that you cannot talk your way out of it. Jengale yellow fever. That one is controlled by statutory bodies like the WHO, World Health Assembly, in relation to the international health regulations. So no mungatini, I mean, if your country has adopted those regulations, there's nothing you can do. So you need to plan before time, see which vaccines are contraindicated, which vaccines you can take, get proper advice. Logonye, like lengfuna kukusho nje gafupi, shortly with travel. Besides just vaccine, you know, logunye mina as a GP, patients that say, yeah, but doctor, you know, then must write this letter. And I used to write a letter, what is this letter all about? Okay, this person is traveling. Preparation for travel. So it's not just for bad vaccination, you know, prepare. If you have chronic conditions, you patiently with the original generics, you know. So that angasebenzi trade name ngolukhandleni iphilisi likhona eSouth Africa maralike India. So doctor fanele incwadi abhale ukuthi unatha ini, anabhale ama doses, abhale reason ukuthi yawanatha. If possible, it's recommended if you are going to Italy, because some countries awakhuluma isingisi. You go to the embassy, ucela bakutranslate le letter, because you have an emergency in Italy. They might take language ngeke. So they must be able to go Spanish, they must be able to go Italian, this is what's wrong. Lokunye lokubalekile futhi sithi no travel mithi yakho lo hamba nayo menda sho ukuthi ihlala ekubag yakho your immediate bag. Ungayifaki kokhabini whereby if my bag selahlekile, my bag sasele kuma interconnecting airports, maphilisi aselele you are diabetic. So good travel is not just vaccines, it's about your health at the end of the day. Ukuze ukwadi kufika le lapho yakhona ube able to carry out my itineraries bonawo ungagcini ulele hotel unga enjoy visit yakho. So it's planning lokubalekile.
Ngaloko akusho ukuthi asithathe nje amabheke sivele sisukeleke sishone pheshe fanele kuvase sivisit abodokotela abafana nawo.
Consulting, I've had bantu labafika aphethe i-prescription like screenshot. Sometimes you are contraindicated to long pills. So we take those things lightly. For me, it was a very interesting course to take, and I realized it's an entire discipline on its own that people should be made aware of and be empowered. And I think things like COVID, they've really highlighted the importance, because Manju was saying, before you travel, you must do a COVID test. That's already practiced in travel medicine. You can't just go to Swaziland. You've got people saying, if I test, I need results, like it's agent. So it's
lapho ku COVID. Uma nomntwana fanele sihambe iCovid konje icala kubani sicala ku what age ku vaccinated?
Talk, I'm gonna
right now, the SAPRA has approved 12 years and up.
Okay.
But there are clinical trials that are looking at a younger age. So probably the next few months or so, when we have kids below 12
Okay.
can vaccinate. But I stand to be corrected every time. You know, there's lots of updates going on, but as far as I know, 12 years and up.
Okay. Manje sis Nomasomi ngabaxwayisa uthini umuntu osekhaya noma umcomfort uthini khona onePolio khona manje akaka understand ukuthi ube infected kanjani, he's angry at himself namhlanje, but nangu wena uyaphila ungamququzela nje uthini ekhaya?
Okokuqala ngizoqala ngi-advise abomama
Yeah.
ukuthi ipolio ikhona. Lama injections lanka bawahlaba eclinic for abantwana mabakhuthazele abantwana ukuthi babathatha abantwana babayise right because umntana uzo end up afana nami. I usually say to the young kids ukuthi iya eclinic uzo end up uhamba nge-wheelchair njengami or uzo end up besebenzisa ama crutches before ngihamba nge-wheelchair. I will say ufuna ukuhamba njengami and then umntana uzothi bese ngithi hamba uhlaba ke. So we need abazali ukuthi baba ngathi bakwenze njalo kube umkhuba wethu thina ma South Africans to go usilisa abantwana. If umzali sekanomntana o-affected yi-polio ungamfihli. Don't hide that child. That child mvela naye eclinic. There are some helps. Uthola ukuthi u-affectwe yileyo polio leyo, but at the end of the day tomorrow uzoba something uzofunda. Ukukhubazeka is not the end of the world. You can do more beyond ukukhubazeka. So we have to live healthy as much as possible.
Abasukume bawu-vaccinate abantwana.
Mabasukume.
Ngiyabonga sis. Dokotela, sentse re tswalla o ka reng ka motho re nna vaccine a ke e batle. Kajeko.
Vaccine re na le bopaki gore ya bereka and re na le diento le gore ba dirile le gore safe e le gore ya bereka. So here le bomme re na le that power ya go decide gore I get protected the adult within my child because manula o tlo and you're protecting manula the adult within that child. But I want to kill out low health because decision you wait around mamutla ya gore vaccinate man it will cost a man 10 years 15 years 20 years down the line. So here on a little vaccine jelo gore ba go tjaka tsona jelo ro di research they are there getting the free why our vaccinate ngwana ha tla o leboa 10 20 years down.
Nizwele nani babukeli lapha emakhaya ihamba kanjalo indaba yethu vaccination and immunization. Uma ngabe ungaka vaccinate lapho noma unohambo lokuphuma eSouth Africa, make sure ukuthi you visit ama traveling medicine doctors and you make sure ukuthi uvaccinatile ama certificates akho konke kuhamba kahle. Nisale kahle babukeli emakhaya.